Hi,
Hi.
my name is Ryan. How are you today?
Good, thanks.
Good. So I'll be the one doing the physical assessment on you today. We have all our instruments ready to go, so let's go ahead and get started. Alright, so first thing we're going to do is check cranial nerve number 1, and that's your sense of smell. So I'm going to have you close your eyes. I'm going to have you plug one nostril for me. I'm going to hold something up and have you smell it and tell me what it is, okay?
Peanut butter.
Good. I'm going to have you keep your eyes closed. I'm going to have you plug your other nostril. And I want you to tell me what this is.
Cinnamon.
Very good. So now we're going to do cranial nerve number 2, which is actually a Snellen test, but we actually already did it in the other room. You had 20/20 vision, so no problems there. We're going to test 3, 4, and 6. 3, 4, and 6, I'm going to have you raise your eyebrows for me. Good. Okay, now I'm going to watch your eyes. So I'm going to have you look at me right here, and I'm going to have you follow my finger, okay? Very good. So now I'm going to test your peripheral vision. So what I want you to do is look straight at me, put my hands behind your head, and I want you to tell me when you can see my fingers, okay?
I can see them.
Good. The next thing we're going to do is check your pupils. Make sure the light's working. It's a little bit bright, but I'm going to stand at a distance and look at your eyes from here first, okay? Very good. Then I'm just going to see how they react. Okay, and now I'm going to go ahead and look closely in your eyes, okay? Good. Alright, the next cranial nerves we're going to do is 5 and 7. So I'm going to have you puff your cheeks out for me. Good. Have you wrinkle your forehead. Good. I'm going to have you open your mouth and shut it for me. And open again. Shut. Good. Smile for me. Frown. Very good. And then does this feel the same on all the sides?
Yes.
Right there too?
Mm-hmm.
It's the same.
Yes.
Good. At the same time, I'm going to check your dull and sharp sensation. So don't worry, I know this looks scary, but it's actually, I'll just press really lightly, okay? So this is going to be sharp, and that's dull. Did you feel that?
Mm-hmm.
Okay, so I'm going to go through a few places on your body, and I want you to tell me whether it's dull or sharp.
Okay. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Very good. So the next cranial nerve is cranial nerve 8, and that's your hearing. Alright, so for your hearing, we use this, it's called the tuning fork. It makes a little bit of a humming noise.
Mm-hmm.
So what we're going to do here is I'm going to get it vibrating. I'm going to put it on top of your head, on the bone right here. It's going to make some vibration sounds. Sorry, the plane's loud. We'll let that pass for a second. That's not going to do well for your hearing. Alright, good. So I'm going to place this on top of your head real quick. And what I want you to do is I want you to tell me whether you hear it in both ears the same or if you hear it go to one side or the other, okay? You hear that?
Yes.
Is it in both sides or one side or the other?
Both sides.
Good. The next, that was called the Weber test. The next one's called the Rene test. This one I do the same sort of thing. I put it behind the bone of your ear, and you're going to hear the vibration noise again. But I want you to just stay quiet. I want you to lift a finger once you can't hear that anymore. And then I'm going to move it off your bone to the side of your ear. And then I want you to listen and raise your finger when you can't hear that anymore, okay?
Okay.
Very good. While I have this, I'm going to check your vibratory sensation. So basically, I'm going to make sure you can feel the vibrations in the different parts of your body, okay?
Okay.
You feel that?
Yeah.
How about that?
Yes.
Feel it okay?
Yes.
Here?
Yes.
How about down here?
Yes.
In there?
Yes.
Very good. So the next cranial nerves we're going to do are 9, 10, and 12. So for this one, I'm going to have you stick out your tongue. Have you roll it around for me. Very good. All right. And then I'm going to have you open your mouth. I'm going to just peek inside here. You haven't had any sores or anything in your mouth? No? Can you stick out your tongue for me? Say ah. Good. So this part's a little uncomfortable. I have to kind of gag you a little bit, so I want you to say ah. I'm going to stick this in the back of your throat a little bit. Good. Sorry. You don't have to do that again. Okay, now I'm going to test your swallowing, okay? So for this, I want you just to swallow normal right now. Good. Now I'm going to have you swallow again while I'm holding right in this spot here. So the last one is cranial nerve number 11, and basically I want you just to shrug your shoulders. Good. And now I'm going to have you put pressure with your head against my hands, or my hand. Thanks. Good. Very good. All right. So now I'm going to have you close your eyes. I'm going to have you put your hand out for me. I'm going to put something in your hand, and I want you to tell me what it is, okay? You can close your hand around it and feel it.
A paper clip?
Yep. And then I'm going to have you keep your eyes closed. Give me your other hand. And I'm going to draw just a letter. And I want you to tell me what letter it is, okay?
A.
Good. Now I want you to go ahead and squeeze my fingers. Good. I'm going to have you pull up, push down. Good. I'm going to have you kind of push your legs out and back. And I'm going to have you lift up with your feet and push down with your feet. Good. Nice and strong. Okay, this next part, they're called rapid alternating movements. So what I'm going to have you do is I'm going to have you do this for me. You can start now. And try to go a little faster. Very good. Okay, I'm going to have you alternate your fingers to your thumb, like this. Good. Next part, I'm going to have you put your finger on your nose, and I'm going to have you reach out and touch my finger, and I'm going to move it in different directions, okay? Very good. Perfect. All right, so for this part, I'm going to have you just stand up. Okay, first thing we're going to do is test your balance. I want you to stand on one foot. Now let's go to the other foot. And then I'm going to have you run the heel of your foot down your shin. Just like that. And then same thing on the other side. Try it one more time. Perfect. Good. Okay, I'm going to have you step away from the table just a little bit. I'm going to have you have the table behind you if you need to catch yourself. I'm also going to be in front of you. What I'm going to do is have you stand with your legs together and arms together. I'm going to have you close your eyes, okay, and just stand there and balance. Very good. Perfect. You can open your eyes now. Okay, so now I'm going to have you just walk normal for me. Okay? Now I'm going to have you walk on your heels now, back to me. Okay? Good. I'm gonna have you walk on your toes. Good. And now I want you to walk heel to toe in like a straight line. Good. You can stop right there. Okay, I'm gonna have you kind of bend over and put your hands on the table right there. I'm going to check your spine now. Okay. Do you have any pain or anything in your spine?
No.
So what I'm checking for here is scoliosis. Make sure your spine's in a straight line. Does that feel okay?
It does.
Good. You can go ahead. And what I'm going to have you do is now is I'm going to have you walk around the other side of this table. Okay. I'm going to check your back again. Okay. And now I'm going to kind of hit your lower back, okay? I want you to tell me if you have any pain.
No. No.
While you're here, I'm going to go ahead and listen to your back. Take a deep breath for me. Another deep breath for me. Okay. Okay. Good. Okay. Okay. And one more. Good. So this part, I'm going to fill your back and I'm going to have you say 99, okay?
Okay. 99.
Okay, I'm going to have you say it again.
99.
And keep repeating it.
99. 99. 99. 99.
Alright, I'm going to have you continue to say 99 again.
99. 99. 99. 99.
Very good. Okay, I'm going to listen to you again, and I want you to repeat 99 again for me every time you feel my stethoscope touch your back, okay?
Okay. 99. 99. 99. 99. 99. 99. 99.
Good. So this time I'm going to have you say E, and I want you to hold it like E, E, E. And I'm going to do the same thing with the stethoscope, okay?
E. 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 E.
Very good. Now this one I'm going to have you whisper 1, 2, 3. So I'm going to have you go 1, 2, 3, 1, 2, 3. Okay?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Very good. Okay, so now I'm going to have you stand up. Maybe come back around this side. I'll have you sit down right here. So I'm just going to check your hair real quick, okay? Alright, you haven't noticed any pain or anything up there? Okay, I'm going to palpate your sinuses. Just feel your sinuses to make sure. Tell me if you have any pain. Any pain there?
No.
How about up here?
No.
Okay, nothing around here?
No.
Okay, I'm going to move down your neck here. Any pain or lumps or anything you notice in your neck?
No.
Okay. Alright. I'm going to go ahead and check your pulse here. Same thing on the other side. And then I'll listen. I'm going to check your pulse and compare it with your radial pulse, okay? Good. While I'm at it, I'm just going to check your brachial pulse, okay? Your radial pulses. So these are your popliteal pulses. You usually can't feel these. But I'm going to check your, this is your posterior tibial pulses. And then your dorsalis penis. You got the right shoes on today.
Yes.
Good. Alrighty, those look good. So now I'm gonna take a look in your ears. Any pain in your ears at all that you've noticed?
No.
Switch sides. Good. Those look good. Take a peek at your nose. Sorry if I blind you with the light. Looks like you got a little bit of a bloody nose. Is that normal for you?
Yes.
How often do you get them?
Every day.
Every day. Is it worse when you blow your nose or? Okay. These look good. Okay. So now what I'm going to do is I'm going to go ahead and listen to your lungs on your front side. Listen to your heart sounds. Okay, take a deep breath for me. Good. Again. 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 Okay. Again. Again. Okay. I'm gonna just check right under your armpit here. And a big breath for me. Good. And listen to your heart sounds now, okay? Just move your necklace out of the way.
Okay.
It's a pretty necklace.
Thank you.
Alright. So this first is your aortic. And then we have our pulmonic. And then we move down to our herbs. Tricuspid. And then mitral. Good. Okay. I'm going to go ahead and have you lay down now. I'm going to have you lay on your left side. Just like that. Okay. I'm going to listen to those same heart sounds, okay? So we've got aortic. Your necklace again. Pulmonic. Herbs. Tricuspid. And mitral. Okay. I'm going to just fill for just a second. Just right under here. Good. I'm going to have you lay on your back now. Just straight on your back, flat.
Okay.
Do you have any pain in your abdomen or anything?
No.
No? Okay. And just your belly real quick. Make sure everything looks okay. Okay, you haven't noticed any lumps or masses or it looks like it's nice and flat. So what I'm going to do first is listen to your belly. I'm going to listen to 4 different spots. Good bowel sounds. I can hear your stomach growling. You must be hungry.
Mm-hmm.
Good. And I'm going to spin this around and I'm going to listen to your aorta, okay?
Okay.
listen to your renal arteries too while we're at it. Okay, sounds good. Now what I'm gonna do is I'm gonna percuss it. That means I'm just gonna listen to the sounds your belly makes when I tap, okay? Okay, I'm gonna just palpate here lightly. Any pain?
No.
Okay, no pain when I do that?
No.
Okay. I'm gonna go around the other side of you. So what I'm gonna do here is I'm gonna palpate your actual liver. When I did those noises with my hands, I could kind of hear where it should be. And so what I'm gonna have you do is I'm gonna have you take a deep breath in, and I'm gonna have you breathe out, and then I'm gonna push really kind of hard on this side, okay? And then out. Good. Not too painful?
No.
Okay, I'm gonna go to the other side, do something very similar. This time I'm gonna have my hand under your back though. I'm trying to feel for your spleen, okay? Okay, I'm gonna have you take a deep breath in and breathe out. Okay, good. Not too bad? Alrighty. So I'm gonna go ahead and have you sit up for me. I'm just gonna take a peek at your cap refill. Looks like you had some nails done earlier. So go to the ones that don't have nails. Mind if I take these off real quick?
Yeah.
Notice any swelling in your feet at all?
No.
Okay. I'm gonna go ahead and have you. I'm gonna push upwards, and I want you to tell me if you have any pain. Okay. Any pain when I do that? How about there?
No.
Nothing. Okay. That's good. I'm gonna test your reflexes now. Okay. Probably seen these before. So the first one I'm gonna do is I'm gonna hold your arm, and I want you to just go really loose for me. Okay. There we go. Kind of feels funny, huh? I'm going to have you actually turn your arm this direction. So that first one was your tricep, now I'm doing a bicep, okay? You see the little flick of your finger there? Good. This is your brachial radio. Feel that little twitch there? Alright. I'm going to do the same down here. Have you just dangle the legs? And then that's your patellar, and then right here we're gonna do your Achilles, and so feel that twitch down. Have you relaxed it real quick? Good. Do the same thing here on the other side. Just relax the arm. Flip it around. One more time. Just relax that arm really good for me. Good. Seems always kind of hard to get. Okay. Good. So that's pretty much everything. Do you have any questions for me?
I don't.
All right. Good job.
Thank you.
Thank you.